basic setup, right? You have your surgical section again, and some of my stuff is missing here. I'll have to get it. Topical, local anesthetic. This is a mouth prop to keep the patient's mouth open. These are scalpels. So this is an autoclavable scalpel. You would change the the blade out and throw those away. This is a disposable scalpel. Okay. This is a lip and cheek retractor, also called a Minnesota, from the University of Minnesota Dental School. This is a periotome. And what this does is it cuts the periodontal ligament. It's not real sharp, but I wouldn't go playing with this too much. Then this is the periosteal elevator, and what this does is it loosens up the teeth. I'll show you later. Okay, loosens up the periodontal ligament around the tooth. And then this is a straight elevator, because it's straight, and what this does is it helps luxate the tooth in the socket, so it's loosening the tooth in the socket, preparing it to be extracted. This one isn't on your list, but you're going to have to write it down. It's called a Selden. Kind of like, what's that guy's name on?
Sheldon.
Yeah. So I always remember it's Selden. That's how I just remember it from Sheldon. This is a Selden. S-E-L-D-O-N. What this does is when they're doing surgery, where they will cut the flap of the tissue and pull that back, and then they might drill with the high-speed handpiece. This reflects the tissue back, and also they'll drill on, and it'll hit this instead of tissue. Okay, so these usually get pretty beat up. These are T-bar elevators because they look like a T. These do the same thing the straight elevator does. It loosens the tooth in the socket. This is a tissue retractor. Notice it's got the little sharp things on there, and you would pull the flap back this way. Mallet and chisel. So these are used to section teeth. So you would use this to for top or bottom teeth. Like this is for anterior teeth, so it's straight. You could use it for top or bottom. This one is for a specific area. The curve goes in the palm of the doctor's hand. So when you pass it to them, you have to make sure that you place it upside down, so when they flip it over to pull the tooth out, it's in the right direction. Okay. So then this one, the same way. This one is specific for lower molars. It's called a cow horn. It has little horns on it, and what it does is it's able to go into the furcation area where the roots are split and grab the tooth like this and pull it out. We don't have it specifically. I think we just have extraction or something. This is a T-bar, a Clier's elevator. This is for root fragments and broken parts of teeth. So when they section the teeth, they would use these to pull the little pieces out. This is a root tip pick. That's exactly what it sounds like. If a tooth is pulled out and a piece of the root tip breaks off, they will use this to search for it and pull it out. So it's kind of like an elevator, but it's got a long shaft on it, so you can get into the socket and pry it out. Bone file. That's exactly what it sounds like. Files down the bone. Sometimes when you pull the tooth out, there's little pieces of bone that may chip or break off, or there's little pointy areas, and the doctor will file that bone. This is a surgical curette. It looks like a spoon, but it's not. It's called a curette. Surgical curette. You have to be specific with this one, because if your doctor tells you to go get a surgical curette and you bring him a curette for scaling teeth, it's not the same thing. Okay. This is used for debriding the socket, so when you pull the tooth out, you're scraping out the inside of the socket, removing any debris that's inside there, as well as stirring up a blood clot, because we want a blood clot to form when we extract teeth. It protects the site. These are called longiers. These are also called bone nippers, but make sure you know the proper name for it, longiers. These are bone longiers, so they'll trim little pieces of bone. These are soft tissue longiers. They look like beautiful cutters. Slap dental on it, so so this is for cutting tissue. These are hemostats. These ones have a long jaw on it. These are for grasping things in and out of the mouth or for placing sutures. These are also hemostats. So these are specifically called needle holders. They have a small jaw, and these are for helping place sutures. Tissue scissors for trimming tissue, and these are suture scissors. These are actually when they come back to have them removed. It has a little hook so that you can grasp the suture and cut. Okay, these are the sutures. These are the gut, and these are the silk. Those are the most common type. Gut is the dissolvable type. Silk is the type that you have to come back and have them removed. Okay. And then you would give post-op instructions. No rinsing that area for at least 24 hours. And when you are able to rinse, you would use warm salt water. It helps tissues heal. If the blood clot comes out, they need to call right away. It's extremely painful. And what happens is the clot falls out, and then it exposes the bone to air, bacteria, food, saliva, and it's extremely painful. It becomes infected. So they need to be aware that that happens. They're going to have little pieces of gauze, which you will wad up in fours, and then they bite down on it to hold the pressure to stop the bleeding. So they have that in for about 20 minutes, then they'll take it out. If it's still bleeding, they can put it back and then a fresh one back in until the bleeding stops. If the bleeding doesn't stop, they need to call the office, as well as there's something they can do. They can get plain old boring Lipton tea, black tea, get the tea bag wet and put that in the site and bite down on it. Something in the tea helps the blood stop, the bleeding stop. If they need to come back for suture removal, you need to make sure that they know that, and they need to come back and schedule that appointment. No sucking through a straw, because the sucking motion will pull the clot out, and then it will cause the dry socket, which we don't want. No smoking. No drinking alcohol. Take any meds that they have been prescribed, as it says on the bottle by directions. What else?
Ice packs.
Ice packs, 10 minutes on, 10 minutes off. They have to take it off because if they leave it on all the time, you can actually get frostbite on your face. You wouldn't want that to happen. It'll kill a tissue on your face. No spicy foods, no real hot foods, anything like that around that area. You might be giving them a little surgical suction syringe thing to clean the area out with warm salt water to keep debris out of there. They can brush their teeth, but they shouldn't get real far back and disturb the surgical site, anything like that. They say if you have maxillary extractions to try to avoid blowing your nose because of the sinuses are up there. You could blow out a sinus. There's a ton of things. I think we might even have it on here with all kinds of... Yep, your last page has a ton of stuff, okay, that goes over after patient care type of thing. These are surgical gloves. They are sterile, so they come in sizes. They're in left and right, so that you would take these out of the surgical pack. They come sterile to you, so you would just open them up and put them on. Okay, so they have the little cuffs all turned down so you can put them on. Okay, and they do come left and right. The left and right ones fit so much better than the ones that we use. They're much more comfortable. And they're longer. They have a big cuff on them. Like that. Any questions? All right. So let's get the endo one out.